Hello and welcome. Today we're delving into a condition affecting the eye called retinal hemorrhage. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to manage it. So, let's get started. Retinal hemorrhage, simply put, is bleeding in the retina. The causes are varied and can range from relatively benign to seriously life-threatening. Common causes include diabetic retinopathy, a complication of diabetes affecting blood vessels in the retina. Hypertensive retinopathy, caused by high blood pressure damaging retinal vessels. Retinal vein occlusion, a blockage of the veins that drain blood from the retina. Trauma to the eye, which can rupture blood vessels. Age-related macular degeneration, AMD, particularly the wet form. Blood disorders such as leukemia or anemia, which can affect blood vessel integrity. Shaken baby syndrome in infants. Valsalva retinopathy, caused by sudden increases in pressure, like heavy lifting or straining. Certain medications, such as blood thinners, and in some cases, the cause remains undetermined, referred to as idiopathic retinal hemorrhage. Now, let's understand the pathophysiology. The retina, a light-sensitive layer at the back of the eye, relies on a network of delicate blood vessels for its function. When these vessels are damaged or compromised, they can leak blood into the retinal tissue or spaces within the eye. The location and amount of bleeding influence the impact on vision. Bleeding can occur in different layers of the retina, each with unique characteristics. For example, flame-shaped hemorrhages are located in the nerve fiber layer, while dot and blot hemorrhages are typically found in the deeper retinal layers. The presence of blood disrupts the normal functioning of the photoreceptor cells, which are responsible for converting light into electrical signals that the brain interprets as images. This disruption leads to visual disturbances. Regarding epidemiology, it's difficult to pinpoint the exact prevalence of retinal hemorrhage as it often occurs secondary to other conditions. However, we do know that individuals with diabetes and hypertension are at significantly higher risk due to the prevalence of diabetic and hypertensive retinopathy. Age also plays a role, as conditions like age-related macular degeneration increase with age. Certain populations may be more susceptible due to genetic predisposition or lifestyle factors that contribute to the underlying conditions causing retinal hemorrhage. The signs and symptoms of retinal hemorrhage can vary widely depending on the location and severity of the bleeding. Some individuals may experience no noticeable symptoms, especially if the hemorrhage is small and located in the peripheral retina. However, common symptoms include blurred vision, floaters which appear as small spots or specks drifting in the field of vision, a sudden loss of vision, either partial or complete, distorted vision, where objects appear wavy or misshapen, and in some cases, pain in the eye, especially if related to trauma. Diagnosing retinal hemorrhage typically involves a comprehensive eye exam performed by an ophthalmologist or optometrist. The exam includes visual acuity testing to assess the sharpness of vision. A dilated eye exam, where eye drops are used to widen the pupils, allowing the doctor to view the retina more clearly. Ophthalmoscopy, using a special instrument to examine the retina for signs of bleeding. Fundus photography, taking pictures of the retina to document the hemorrhage and monitor changes over time. Fluorescein angiography, a procedure where a dye is injected into the bloodstream, and pictures are taken of the retinal blood vessels to identify areas of leakage or blockage. Optical coherence tomography, OCT, a non-invasive imaging technique that provides detailed cross-sectional images of the retina to assess the extent of the hemorrhage and any associated retinal damage. Retinal hemorrhages can be classified based on their location and appearance. Common classifications included flame-shaped hemorrhages, which appear as streaks of blood in the nerve fiber layer. Dot and blot hemorrhages, smaller, rounder hemorrhages located in the deeper retinal layers. Subretinal hemorrhages, which occur beneath the retina. Vitreous hemorrhages, where blood leaks into the vitreous humor, the gel-like substance that fills the eye. The classification helps determine the underlying cause and guide treatment decisions. Treatment and management strategies for retinal hemorrhage depend on the underlying cause and the severity of the condition. In some cases, small hemorrhages may resolve on their own without treatment. However, for more significant hemorrhages, or those associated with underlying conditions, treatment options include managing underlying conditions, such as diabetes and hypertension, is crucial to prevent further bleeding. Laser photocoagulation, using a laser to seal leaking blood vessels in conditions like diabetic retinopathy. Intravitreal injections of anti-VEGF medications, which block the growth of abnormal blood vessels in conditions like wet AMD and diabetic retinopathy. Vitrectomy, a surgical procedure to remove blood from the vitreous humor. Observation, in some cases, the best approach is to simply monitor the hemorrhage and allow it to resolve on its own. The specific treatment plan is tailored to the individual patient and the underlying cause of the retinal hemorrhage. While not all cases of retinal hemorrhage are preventable, there are steps you can take to reduce your risk, particularly if you have underlying conditions. Manage diabetes and hypertension effectively. Maintain a healthy lifestyle with regular exercise and a balanced diet. Avoid smoking. Protect your eyes from injury by wearing appropriate eye protection during sports or other activities. Get regular eye exams, especially if you have risk factors for retinal hemorrhage. The prognosis for retinal hemorrhage varies depending on the underlying cause, the severity of the bleeding, and the promptness of treatment. In some cases, vision may return to normal after the hemorrhage resolves. However, in other cases, permanent vision loss can occur, especially if the hemorrhage is large, located in the macula, at the central part of the retina, or associated with irreversible retinal damage. Recent research is focused on developing new treatments for retinal diseases that cause hemorrhage, such as gene therapy and stem cell therapy. Advances in imaging technology, such as OCT angiography, are also improving our ability to diagnose and monitor retinal hemorrhages more effectively. Early diagnosis and appropriate management are crucial for maximizing the chances of preserving vision and preventing further complications. Consult your eye doctor immediately if you suspect you may have retinal hemorrhage.